What does it take to become a radiology technician? Age 18, you graduate from high school. You want to work in medicine, but absolutely refuse to deal with the bodily fluids of nursing. You've never taken an x-ray before, but one day doctors will rely on your images to diagnose serious conditions. Salary $0. Age 18, radiologic technology program. 2 years, anatomy, physics, radiation safety, patient care, image evaluation, and clinical rotations in actual hospitals. You learn how to position patients in pain without making it worse, how to capture a perfect image while a child is squirming, and how much radiation a body can safely absorb. Salary $0. Age 20, graduation. Now the real test, the ARRT certification exam. About 200 questions covering radiation protection, equipment operation, image production, and procedures. You pass. You're now a registered radiologic technologist. Most states also require a license to practice, so you apply for that too. Salary $0. Age 20, first job, hospital. Day 1 feels like a movie until your first trauma case rolls in at 2 a.m. Multiple injuries. The ER doctor needs imaging now. You're positioning a patient who can't move while monitors are going off and someone is yelling for vitals. You take the shot. The image is clean. The doctor sees what they need. Surgery starts 5 minutes later. Salary $62,000. Age 23, experienced tech. You've imaged thousands of patients. You can spot a fracture on a screen before the radiologist even walks in. You know which positions hurt, and you've learned to work fast and gentle at the same time. Salary $75,000. Age 27, you add a second modality. Most techs do. You go back for post-primary certification in CT or MRI. Months of additional coursework and clinical hours. You pass the ARRT exam in your specialty. Now you're not just an X-ray tech. You're running CT scans on stroke patients at 3 a.m. or running MRIs on patients with brain tumors. Specialty certification typically adds $10,000 or more to your salary. Salary $90,000. Age 35, lead tech. You've been at this for 15 years. Newer techs come to you when they don't know how to position something tricky. You teach them what no textbook does. You run the imaging schedule for an entire department. Salary $105,000. Age 45, senior tech in a specialty unit. Interventional radiology, cardiac cath lab, trauma. You're standing next to surgeons during procedures, providing live imaging that guides where the catheter goes, where the wire moves, where the stent gets placed. Your screen is what's keeping their hands accurate. One blurry image and the procedure stops. Yours never blur. Salary $130,000.